How many deaths could be prevented if everyone who qualified for lung cancer screening received it? What are the latest recommendations for treating peripheral neuropathy? This and much more on today's JAMA Editor Summary. Hello and welcome to our listeners around the world. Today is Friday, November 21st, 2025. I'm Dr. Linda Brubaker, a JAMA Deputy Editor and Editor-in-Chief of JAMA+ Women's Health. This week, I'm sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by co-host, Deputy Editor Dr. Preeti Malani. Hi, Preeti. These past few weeks, we have had some great nephrology and cardiology content. This week, let's start with a totally different topic, arsenic.
Hi, Linda. Arsenic is a naturally occurring element, and elevated concentrations can be present in drinking water, especially well water. Chronic exposure to arsenic has consistently been linked to increased mortality from multiple conditions, including cancer and cardiovascular disease. Dr. Fu and colleagues investigated the associations between reductions in arsenic exposure and mortality risk. Now, this was a very interesting prospective cohort study that included about 11,000 participants from Bangladesh in a region with varying levels of well water arsenic. Arsenic levels declined over time as a result of community mitigation efforts. The participants had their urinary arsenic levels measured up to 5 times throughout the study period, and the investigators measured mortality from chronic diseases. Now, this study spanned more than 20 years. The authors report that each interquartile range decrease in urinary arsenic was associated with a 22% lower chronic disease mortality, 20% lower cancer mortality, and 23% lower cardiovascular disease mortality. The authors conclude that reduced arsenic exposure may contribute to improved health in populations exposed to contaminated drinking water.
That's very interesting, Preeti. Thank you. And in our introduction today, we asked, how many deaths could be prevented if everyone who qualified for lung cancer screening received it? In their JAMA research letter, Dr. Bondi and colleagues help answer this question by providing national estimates of lung cancer screening in the U.S. Lung cancer screening is recommended by the United States Preventive Services Task Force and can help reduce lung cancer mortality for those with a smoking history. The authors used results from the 2024 National Health Interview Survey and validated models to estimate lung cancer screening in the U.S. They also calculated deaths prevented and life years gained at current screening rates and if screening were increased to 100%. They included data from individuals 50 to 80 years old without lung cancer who had ever smoked. They found that only 18% of individuals who were eligible for lung cancer screening in 2024 received it. They also report that increasing the current uptake to 100% could result in a 3-fold gain in life years and prevent deaths.
Alexandra Potter and colleagues wrote an editorial about this study. They'd review who qualifies for lung cancer screening and reflect on how lung cancer screening could achieve its full life-saving potential.
Preeti, let's talk about the newest JAMA Viewpoints. Drs. Nswami and Figueroa addressed direct-to-consumer tests for 2 common communicable diseases, chlamydia and gonorrhea. They explained that, while convenient and perhaps more comfortable for patients, oversimplifying these tests can miss important nuances for appropriate infection treatment. And in their viewpoint, Dr. O. Sunran and Wadura discussed the ambulatory specialty model and how it engages specialists in value-based payment models.
In another viewpoint, Drs. Matt and Benowitz addressed the recently passed California Assembly Bill 455. The bill addresses third-hand smoke, which occurs when tobacco smoke and vaping aerosol residues stick to indoor environments on things like carpets, drywalls, and ventilation systems. This bill requires third-hand smoke contamination to be disclosed in residential real estate transactions.
Spend some time this week reading the JAMA review on peripheral neuropathy, a condition that affects approximately 1% of adults worldwide and can be associated with significant disability. This comprehensive review by Dr. Mauerman and Dr. Staff covers pathophysiology as well as evaluation and treatment. Dr. Mauerman joined JAMA Deputy Editor Dr. Mary McDermott to discuss diagnosis and optimal management of peripheral neuropathy. Let's listen to a bit of their discussion.
I wonder if you can discuss treatment for us. Your review refers to topical therapies and oral therapies and neuromodulatory therapies. And I'm interested in what's your approach when you have a patient with newly diagnosed peripheral neuropathy?
So I gauge my treatment based on the severity of their symptoms and what they've tried before. So if a patient's coming in and just has mild sensory symptoms that are maybe more tingling, prickling, electrical shock, burning, and it's really restricted to a limited area like the toes or the feet, then the first thing I would try usually is conservative therapies. So trying cool soaks of the feet for 10 minutes before bed, drying the feet off, and then trying a topical agent. And there's several topical agents that have been tried in testing, including lidocaine formulations, so lidocaine creams, lidocaine gels, and then a lot of other medications can actually be compounded into topical creams. A lot of the ones that we use orally, we can actually put in a cream as well.
And the latest JAMA Insight article is featured on the JAMA Plus Women's Health site. Dr. Miller and colleagues cover pharmacologic treatment of perinatal depression, a diagnosis that affects about 1 in 7 individuals.
This week's patient page reviews osteoporosis, a common condition for older adults. It includes helpful information about DEXA results, anti-resorptive drugs, and much more for patients.
Clinicians may want to share that patient page with family and friends as well. On the JAMA+AI Conversations podcast, JAMA Associate Editor Dr. Yulin Swen interviews Dr. Horvitz, the Chief Scientific Officer at Microsoft. They delve into AI's current and future clinical roles. It's a fascinating conversation. Let's listen to a bit of their conversation.
You know, we celebrate scientists who come up with deep insights and pursue them and validate their results and come up with valuable, useful inferences, artifacts, technologies. What does it mean when scientists begin using tools that can generate hypotheses, help deeply with scientific reasoning and planning of experimentation, for example, and even executing experiments of the form that we would give out awards, prizes, commendations to human scientists in the past? Well, how do we give attribution to models and ensure that when there's a human AI experience in the sciences, for example, we understand the role of an AI system? On replicability, I don't know if people have noticed, but sometimes models are changing even when they have the same name. In a recent paper that I co-authored that appeared in the PNAS just about a year and a half ago, entitled Scientific Integrity in an Era of Generative AI, we call that a set of recommendations and needs and caveats about the use of AI tools in the sciences.
And with that, there's also been a lot of rapidly developing medical news. Our outstanding JAMA Medical News team stays on top of it all and gets you the latest articles in clinical medicine, biomedical research, public health, and health policy. Find it all at JAMAmedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens, Ella Barnes, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.